All right, so this video is going to talk about how to classify patients who have asthma. And this is going to be a good first step, and it will guide you kind of when you're doing your history taking, when the patient's coming in, to see, do I need to move them up? Can I move them down? Where are they from the last time I talked to them? Or if it's a new diagnosis, where are we starting at? So definitely an important first step. Really two big classifications when it comes to classifying the patients with asthma. They either have intermittent or persistent. Intermittent meaning, yeah, they're having asthma symptoms, it's just happening like 2 times a month, something like that. Not a really big deal. They might be getting woken up 2 times a month with asthma, but they're not any more than that. They're not using their inhaled their albuterol more than 2 times a month. That's going to be your intermittent person, and that is where you want the patient to be. Then when you go into the persistent asthma, you have mild, moderate, and severe. Now to start, we're going to have the criterias. How many how many symptoms are you having per week? How many times are you being woken up during the night per week? And how many times are you using your albuterol per week? Or is it interfering with your normal activity? So for someone with mild, you're not having daily symptoms, but you're having it about 2 times a week. That's going to pull you out of the intermittent and put you into the mild. And I should add, if the patient, you put them by whatever their most severe class is. So if they're saying, I have no functional limitation, but I'm being woken up every night of the week with asthma, you're going to put them in the severe, whereas because they're being woken up every night per week, but they're saying no functional changes, which would be more an intermittent. So go with the most severe function that complaint, sign, symptom that they're reporting. So for the mild person, they're having symptoms about no more than 2 times a week. Definitely not daily. They're being woken up about 2 to 3 times a month with asthma symptoms. They're using their albuterol about 2 times a week, and they have really minor limitation. Their forced FEV1 is above 80. When you go into moderate, you're having daily symptoms. You're being woken up more than 1 time a week, but not nightly. You have some limitation, and your FEV is over 60 and under 80. When you're severe, you're being woken up almost every night of the week. You're having symptoms throughout the day. You're using your albuterol several times a day, and your functional status is severely limited. All right, so that's really all there is to classifications. You have intermittent or persistent. Under persistent, you have mild, moderate, and severe. And the questions you want to ask are, how many times a week are you having symptoms? How many times are you using your inhaler per week? And how many times per week are you waking up with asthma symptoms? Okay, I hope that was helpful. Thanks. Bye.